Joining us now is Dr. Nate with WeDriveHealth. Welcome to the show, Dr. Nate. How are you?
Good, good. How are you, Donna? Thank you for having me.
Oh my gosh, what made you decide to go into medicine?
So growing up, I had a lot of uncles who were physicians, and I had a lot of time or a lot of sick elderly patients, I should say elderly family members. And I spent a lot of time in the hospitals, unfortunately. So I got to see what the healthcare profession was like. And I wanted to contribute in so many different ways.
Okay.
So that's what made me
So
think.
originally you were working at an ICU, correct?
Yes,
and
yes.
then what happened? It was just like
Yes.
too much drama there, or
Oh,
what?
well, it was a great time.
Right.
It was a lot of learning. It was phenomenal teamwork, and I worked for a great institution that taught me a lot. But unfortunately, when COVID happened, it was a lot in terms of longer work hours. It took an emotional toll on many of us to see a lot of things that were going on in the ICUs. And then eventually what I noticed was that there were a lot of family members and patients themselves who didn't understand their chronic conditions.
Okay.
So I felt empowered to kind of transition to the outpatient world, create a primary care office or primary care like healthcare system that really empowered and educated our patients.
Okay, so
yeah.
we drive health, meaning like you're the force that wants everyone to be healthy.
Correct.
So holistic approach to it.
Correct,
Okay,
correct.
and wellness.
Correct.
Okay, so
Yeah,
what
yeah.
do you do there? What's the mission?
So the mission is we provide equitable care to all that is high quality, and that is not only your traditional primary care, but also your non-traditional. We don't want any of our patients to feel scared or uncomfortable coming to us about any complaint. For example, if they have fatigue or hair loss, or even weight gain that they're concerned about and they can't figure out what to do with that, we look for non-traditional ways of combating that and just empowering our patients so that they know that there are other options besides your traditional oral medications, and just feeling like they're part of this comprehensive personalized care that we provide.
I always just go to Google, right? I'm like, well, my thumb, this thumb hurts. I'm like,
Right.
is it arthritis? You know, like I'm one of those people that just like research everything until I think I have everything.
Right.
Okay. Like I'm like,
Fair.
oh, I'm gonna die tomorrow. You know. At what point can
Yeah.
someone just call you? Is it when they have a pain in their thumb? Is it the simple things also that somebody could reach to you for help?
Yeah, so we
Okay.
pride ourselves at WeDriveHealth that is urgent care as well as primary care. So you do have that thumb complaint, absolutely come right in. But while we're there, we're gonna address other things as well. How is your sleep? How is your eating habits? Are you exercising? Are you facing other things that you're not too comfortable or didn't realize was a mental or even emotional or even a physical complaint that now we can actually bring to the forefront? So yes, so we'll take care of that thumb, but we'll also take care of everything else. Very comprehensive and holistic.
Sometimes too, if somebody comes in and they're having like phantom pain,
Yes.
or they're having, PTSD,
Yes.
do you have other people on your team or someone that you can refer people to? Because a lot
Mm-hmm.
of times, sometimes it might not be physical. It might also be like a mental that's causing itself to appear as physical.
Yes, many of the times, especially since post-COVID, we are seeing a lot of symptoms that are manifesting very subtle. We can't really figure out what's going on. Patients are complaining of this phantom pain or just pain that they can't really attribute to anything in particular. So what we did is we did team up with a team of healthcare professionals that are trained in mental health as well.
Okay.
So I do have a psych nurse practitioner that I work with very, very closely. And sometimes what we're able to do is dial in during that visit and see if we could go ahead and add that as part of the visit as well. So we
Wonderful.
do have mental health professionals on site just to help with everything.
And you look like you're like a glowing epitome of health,
Oh.
right? I know, but I guess you try to do the right thing, right? You exercise, you
I
eat
do.
right,
I
right?
do.
Preventative medicine.
I do.
Okay, so Dr. Nate, thank you very much. And is it easy to just call you and make an appointment?
Absolutely.
Okay, do you take different insurances or do you take private pay? Like how can somebody onboard with you?
Absolutely. So we take most major insurances. So usually what we do is we give our phone number to the general public and they will call and we do a quick verification on our system. It takes less than 15 minutes. We get back to the patient and let them know that we accept their insurances. Even if we don't accept their insurances, because we believe in equitable care for all, we will come up with a very, very simple payment plan or something very affordable for all patients to ensure that they get the high quality care. Thank you.
You're awesome. You are awesome. Thank you,
Donna.
Dr. Nate.
Thank you.
Happy journeys to you, happy health to you,
Thank
and
you.
to all those that you serve. Nice to have
Absolutely.
you here.
Thank you so much.
Wow, we're living it up, and we care about your health. So if you just need a checkup, reach out to somebody locally, or you can even dial into them, and they could probably refer you to someone. Thanks for watching.